Hey guys, so there is a common term that patients use all the time when they come to see me initially. When they hurt their back, they generally say, "My back went out." I generally don't understand that saying. I get it to the most degree that something happened, but it didn't go anywhere. It didn't come back. It just was in a situation that was maybe not ideal for what you could tolerate. So generally, what I find is patients that I see put their back in a situation that their muscles maybe weren't ready for. So either if it was repetitive bending, reaching, lifting something from the ground that was really heavy that they haven't done before, usually that's what I find. It's you're putting your back in a certain situation that it hasn't been in or is foreign. So obviously the likelihood that your tissues, muscles, tendons, things like that aren't going to perform or get stressed to a point where they get overloaded. Then their function is going to decrease to stiffen your spine and increase stability. Hence, maybe create some pressure in a disc, in a nerve, creating that reflexive response for that muscle to guard. From there, does it come on slowly as the day progresses? See that a lot. Is it severe and acute right away and you just know, man, I messed something up? It doesn't matter. Generally what happens is you get some sort of inflammation. We can't really see it like you would on a knee or an ankle that gets swollen, but you can kind of tell. The muscles are guarded around there. They look stiff. Your spine slightly like straightens if you were to get an x-ray, say if it's even been a couple days or a couple weeks. Your spine's fine. It's just your muscles are trying to hold that spine so stiff that it doesn't want it to move. It's in more of a protection phase. So my goal after seeing you initially is to allow you and to give you reassurance that you got to start moving again. Whether if that's small movements, whether if that's walking, whether that's just strategies to not sit too long, don't take long car drives without getting up, or even sleep positions, etc. So from there, hopefully you can get some reassurance that you didn't damage or injure anything. You just put your back in a situation that it wasn't ready for. So what do we do now? Mainly, I think a lot of people will rest, which is okay. Maybe avoid a little bit. Not bad. I usually tell people to actively rest, so still walk, still move around, do what you can. The other thing is kind of maybe find positions that are comfortable as well. So laying on your back with your feet up on something, not a bad idea. Generally try to perform some light range of motion exercises. Maybe that's just slowly bending over, touching your toes, standing or sitting. Lay on your back, moving your knees side to side. Usually should feel pretty good if it's done pretty smooth and slow. Some people will generally resort to ice or heat. I would say, hey, that's not going to hurt you in general, but so why not? Most things that are inflamed, I would put ice on it, see how that feels while in a comfortable position, or if it feels tight, guarded, and stiff, apply some heat. Generally, those are pretty safe and generally aren't going to cause any problems. From there, a lot of times you go to a primary care physician or anybody like that for advice. What are they going to do? They're going to give you over-the-counter meds, maybe something a little stronger like a steroid dose pack if it's inflamed, things like that. Other than that, they're not really going to do anything for you except for maybe take an x-ray and send you to physical therapy. From there, again, thinking maybe a little more on your posture. We don't want you to be standing rigid, stiff, or guarded. It's okay to kind of be a little bit more upright and keep a little bit more alignment involved. But obviously the goal is to move and get your spine a little bit more relaxed, which movement causes. From there, I tell people to avoid sometimes those end range positions that might be painful at the moment. That's okay. If we can still move and get into mid-ranges or a little bit further, perfect. That's what your spine really wants to do. It heals faster. It feels better faster. Sleeping, stuff like that. finding postures, pillows, support systems that you can sleep well, that should hopefully calm down things, and then your body can recover at night. Again, most of our body does a lot of healing at night, so hopefully we can figure some options there. And then, if things aren't progressing and improving, and I would say 2 to 4 weeks, I would probably go talk to more of a skilled professional like myself, even chiropractic, anyone that can kind of give some relief and give you a better idea what's going on. We want to make an acute flare-up not become a chronic one. So if symptoms aren't improving in probably that 2 to 4 week range, you need to go seek some advice. And then from there, hopefully we can get the process started, and then we can kind of give you reassurance on what to do and give you some pretty easy tips that should help kind of make things feel pretty good pretty quick, and then you're back to where you started.